Hi, this is Mike Bauer with Houston Independent Insurance giving you a special update on the Inflation Reduction Act. And this is September of 2024. And we're coming up on the pre enrollment time, October 1st through the 14th, where we can look at plans, and October 15th through December 7th, we can actually sign up, which will go in effect January 1st. And the Inflation Reduction Act is going to affect the standalone prescription drug plans and their coverages, and then also Medicare Advantage. That include drug plans is going to be affected as well. So I wanted to give you an update on that and explain that a little bit more for you. So this was an act that was passed in 2022, and the major impacts are going to be taking place here in 2025, coming up next year. So what is going to happen is one of the good things is there's going to be an elimination of the coverage gap phase, the infamous donut hole. So round of applause. Glad that that's going to be gone. And then also there is going to be an out-of-pocket maximum. So a nice thing, $2,000 out-of-pocket maximum. So for drugs that are on the formulary list of your carrier, if your prescriptions are on that, you'll no longer pay anything after 2000 during the calendar year. And it's also going to require that the Medicare plans offer you prescription payment plans. If you have high costs, you can divide your payments up. I'll explain that a little bit more here towards the end. And that Part D plans and drug manufacturers will pay a larger share of the drug costs, but also the carriers after $2,000 are going to be paying 60% of that cost. So we think that will have an impact on you, the consumer, in possibly some negative ways. So we'll talk about that here in a little bit. So what'll happen is next year things are going to be simplified. There'll be a $590 annual deductible. So your first $590 you pay. Now maybe some of the generics will not be on that deductible. We'll see what the plans will do. And then after you reach your deductible, then you're going to pay a 25% co-insurance. And then when you've reached $2,000 out of your pocket, then you're done for the rest of the year, as long as your prescription is on the formulary. And so we see how that changed from last year. This is I'm saying last year in 2024 is actually this year, time of this recording. But in 2025, then they're going to have this maximum out of pocket. So what this is going to do is it's going to give you an option to pay monthly for, when you have high prescription costs. You can separate your payments out because that deductible is going to be expensive at 590 at the beginning for some of you. We probably, I'm going to guess, people that have tier 3 and up prescriptions on a lot of these plans. And so it'll allow you to spread out your payments over the whole year. Now, the way that's going to work, it's not mandatory, but the way it's going to work is if one of your prescriptions is over $600, then you can qualify for this program where you can spread those payments out. Your carrier here is Part D sponsor. They will have to notify the pharmacy to notify you about the program, that you don't have to pay at that point. You could actually spread your payments out over the year or when you want to start this. So if you meet the criteria, you have the flexibility to opt in and out during this plan during the year payment plan. Now, Part B is in boy drugs. Those are drugs given in the doctor's office. Those, in most cases, those will now be part of this program. But some medication and also medications that are not on the member's formulary do not qualify. And so then the insurance carrier is going to spread out the costs for you, and you're going to be paying them instead of the pharmacy. Now, this may have an impact on an employer plan. Some folks work past 65. They stay on their employer plan. They don't go completely on the Medicare. And it could affect you in that some of the employer plans may no longer have what's called credible coverage. That means coverage that is at least as good as Medicare Part D or better. And so they're going to have to tell you that they're no longer credible. And that means then you would need to be looking for a Medicare plan that is credible, and you might have to transition out of your employer health insurance. Now, this is going to have some impacts. Some, are going to be positive. Obviously, the $2,000 out of pocket maximum is a positive, and no longer having the donut hole, that's positive. Some possible negatives: premiums may go up, copays and cost sharing may go up, drug tiers, you may have prescriptions that used to be on like a tier 1 and 2, maybe they get moved to 3 or 4. I don't know, we'll see. Formularies, maybe some prescriptions will come off to kind of sustain some of the extra costs. Maybe some of the pharmacies will no longer be a network on your plan. We'll see. I do know one thing that is happened that it is negative from my perspective is that for quite a few of my clients, I am no longer going to be your agent on your drug plans, just on drug plans, not on Medicare Advantage or Medicare supplements at this point. But agents are going to be removed from certain plans. So certain carriers are going to no longer have us as agents. So you'll have to go directly to the carrier after January 1st. And so we'll give you more information on that here in the near future and explain to you what's going to go on there. So I'm here to help you out, and I'm local, and I can help you. I know these plans here in the Houston, Texas area. And if you have questions, you can give us a call, and we'll help you out. There's no obligation, no cost for our services. The carriers do take care of us in most cases now. I mean, in some cases they're not going to anymore, but still most of them will. And so you can email me at this email address here, office@HoustonII. Call this phone number up there. I got the website here. You can look at HoustonII.com to learn more. And I'm located here in Pearland near the Friendswood border is where my office is at. So look forward to helping you out and taking care of your questions and your needs and take the scare out of Medicare. All right. Look forward to seeing and talking to you soon.